New South Wales authorities have updated testing and isolation requirements for close COVID contacts as infections reach record highs. The measure is precautionary to avoid a lockdown over Christmas.
For the second consecutive year, New South Wales residents are on alert as COVID cases rise in the lead up to Christmas. Rules for confirmed cases and close contacts have changed to curb rising infections due to the Omicron variant. Close contacts must now isolate for 7 days after getting tested. For the next week, they'll not be allowed to enter a high-risk setting and must be tested again on day 12, regardless of vaccination status.
The crucial thing is that cases will increase. We have said that from the outset. When we opened up after lockdown, we said as mobility increases, case numbers will increase.
Hospitals will move to red alert level operations. Visits will be limited to compassionate reasons only or to provide care to pregnant women, children or patients receiving palliative care. Staff will also be required to wear PPE to ensure there is no risk of spreading the virus. The number of COVID cases admitted remains stable at 215, up from 192 the day before. 24 patients are in ICU with COVID-19. Authorities confirm hospitals are well equipped to deal with the outbreak, but they are monitoring the number of cases in hospitals as a determinant for any potential lockdowns. New South Wales health experts are looking to avoid lockdowns over Christmas, but may reimpose restrictions on unvaccinated residents.
These are the sort of modest restrictions that I think would be necessary for Omicron, but I think the days of the blanket restrictions, the not leaving your home, the work from home, they really should be well behind us now.
The New South Wales opposition leader is in favour of any changes that will curb the outbreak.
I'd say to the Premier, if you're receiving advice from Kerry Chan and you do need to tweak these rules in the service of the larger goal of avoiding lockdowns in New South Wales Labor would support those measures.
We need to learn to live alongside the virus, and the best way of doing that is to continue the strong vaccination rate. We've seen that New South Wales hasn't just led the country, it's led the world when it comes to high vaccination rates. What is crucial though is that we continue a strong booster campaign.
New South Wales has reported its highest daily caseload of COVID infections since the start of the pandemic, 2,213 infections from 145,000 tests. Health authorities are warning residents to avoid large public indoor gatherings to prevent super-spreading events. The latest being a Taylor Swift dance party at the Metro Theatre in Sydney CBD. 600 attendees have been ordered into isolation for 7 days. Household contacts have also been told to isolate until they receive a negative test. At least 97 partygoers have so far been infected with COVID-19. Authorities say it's likely they've contracted the Omicron variant.
We're continuing to see a rapid rise in cases of COVID in New South Wales, with transmission occurring at social gatherings and venues such as pubs and clubs, and some of these have led to super spreading events.
The message from authorities is to remain alert but not alarmed.
People respond a lot better to messages of hope than they do of messages of fear. So I think the whole fear factor needs to be dialed back, and we need to act very responsibly as medical leaders when we talk to the public about Omicron.
Jessica Maggio, Sky News, Sydney.